This conference will now be recorded.
All right, so thank you all so much for coming to the Point in Time Count volunteer training. I know some of you have volunteered with us before and some of you are brand new, so welcome back for those who have, and welcome for the first time for those who haven't. Today we're going to go over just a little bit about the COC, the Continuum of Care, and the Point in Time Count, what we're going to be doing in conducting the count, and then we're actually going to go over the surveys. And I'm hoping we have everything that you need to feel comfortable in volunteering with us. I will say now that either today or tomorrow you will be receiving your assignments for your teams. So if you have any questions about where you are, just know that that information is coming. You haven't missed anything. All right, just to get us started, just a little bit about a continuum of care. A continuum of care is actually a federally mandated network of organizations who prevent and end homelessness in a given region. And we do that through strategic planning. So a lot of the job that I do around the continuum of care is actually bringing partners together to help deduplicate services and efforts, and all of us working together in a systematic way to prevent and end homelessness for our region. Across the state has full coverage of some sort of continuum of care. We are going to be that light green one in the corner. We cover the entire planning district 16, so Spotsylvania, Stafford, King George, Caroline, and the city of Fredericksburg. And for us, what you need to know about the Continuum of Care is that it's not an entity itself, but really a network of organizations throughout the entire community. So the George Washington Regional Commission, which is who I am with, we oversee the Continuum of Care by providing staffing to help coordinate all of those partner providers and serve as the lead agency in federal and state applications and oversee our database of how we actually track people who are using our system. But we do not provide any direct services. We actually rely on lots of partners in our community to do that for us. So we partner very closely with the VA, Empower House, Lois Ann's Hope House, Micah Ministries, the Brisbane Center, FAHAS, and Volunteers of America to provide those traditional homeless services that you will see. So things like shelter and housing programs, street outreach, all of those things. But those partners can't do it alone. So they really rely on a whole network of partners to be able to do that and make a difference in our community for those who are experiencing homelessness. So it's anywhere from the Mossbury Clinic, who's going to provide some healthcare resources, to the SPCA for homeless animals and under-resourced individuals, to even serve for food pantries. So they don't provide your traditional homeless services, but they touch the lives of people who are experiencing or at risk of experiencing homelessness and therefore play a key part in their stability. And so for us, what you need to know about the point in time count is it is something that we do every single year. We traditionally do it in January. So if you have volunteered with us in the past, most likely you've done that in January. We are, for the first time in about 7 to 8 years, doing this in the summer. Our homeless services and our environment looks a lot different from January to July. We no longer have the cold weather shelter open. Our hotels have shut down for COVID, and it's warm. So it's a lot easier for people to actually stay outside and not have to risk freezing to death. So we wanted to get a better idea about what our homeless services look like and what our homeless population looks like in summer as well as in the winter. So we really use this as an opportunity to collect information on people who are experiencing literal homelessness. This summer, we're actually expanding that even more and trying to figure out those who are at risk of homelessness. So we'll go over that in the survey and what that looks like. But for us, our local goals is that we are able to track our progress over time and really get an estimate of the current rates of homelessness for our region with the point in time count data that we receive. And then on a national level, HUD actually assesses the national trends in homeless services, and they create a report for Congress that helps with determining funding levels for homeless services in the country. So numbers are really important for us on a local level, on a state level, and then even on a national level. Any questions before we go through actual count and what that's going to look like. Okay. So as we have before over the last 2 years, just letting you know that there is a short survey that comes out just to remind you of the symptoms of COVID, remind you if you're experiencing any of those, stay home. So you will be receiving that on the 26th of July, so next Tuesday, and you'll be just asked to do a self-check. I mean, I think most of us have been doing this for the last 2 years, but it's just a quick reminder that any volunteers who come with symptoms are putting themselves and other volunteers and the people experiencing homelessness at risk. So we just ask you to stay home and volunteer with us another time. On the actual day of the count, there's a couple of things that we're going to walk through, but this is what it's going to look like primarily. You're going to meet your team and be able to introduce yourself to your team lead and get to know your other team members you'll be working with. You're going to find and approach people to actually do the survey with, and we'll tell you how to do that. You're going to do the survey, and we'll walk through what that looks like. And the final piece is you're going to wrap up and give out incentives and kind of finish out the conversation. Overall, in all of these steps, I think safety and respect is the priority that we have, not just for COVID, but for anything when we're dealing with walking into people's homes or places of encampments, having the safety, but also the respect to know that their lives looks different from ours, and that's okay. So just coming with an open mind and being respectful of their space, but also keeping yourself safe at the same time. All right, so for meeting your team, like I said, each of you will have a team leader, and then there will be about 2 or 3 volunteers in your team. Team leads have been doing this for a number of years, so they will be your expert in case you have any questions or need anything throughout your volunteer time. They're going to check in with us. Some teams are actually going to meet us here at GWRC, but you'll have all the information about where to meet your team and your team leads in the email that goes out to you today or tomorrow. So do not worry about that piece. For volunteers, you're going to check in with your leaders, and they're going to give you some instructions about how to get started and kind of set up a plan for your volunteer schedule and the sites that you're going to be working. And they will have everything that you need. They'll have all the surveys, all the incentives, all the sign-in sheets, all of the things that you might need, extra pens, anything that you might need for your time with us. Now, when it comes to actually approaching interviewees, there's usually 2 places that we have volunteers in. There's service sites, and then there's field locations. So our service sites, one of our most popular is our day center. They actually are able to go into a drop-in center, get a shower, get food, check their mail, do those kinds of things. During COVID, that was our only service site we were doing because many of them were shut down. We now have added service sites with meal locations, libraries, pickups, things that we know people experiencing homelessness are using through the day, so there will be some additional ones. So for people who are at service sites, you are going to be connecting with individuals that you see entering and leaving the building and try to get an idea from them about where they might be staying. Some of them may or may not be homeless, but just ask them a question about whether or not you can provide them with a short survey and get some information from them to see if they would qualify for the full survey. For field locations, usually it's a little bit easier. We're talking about encampments in the woods or actually seeing people physically sleeping on the street or something like that. So you have more of an awareness that those people are actually homeless. So you're going to approach them, tell them a little bit about your survey, and then ask them to take it. And so when we're talking about approaching interviews, this is kind of the guide that we have, which is, like I said, if you're in an encampment, please announce yourself and wait to be invited into their space if you can. If you see someone who is awake and in sight, then you're able to introduce yourself and start your survey. We have a brief script for you about what our program, what we're doing and what the survey is for to kind of get them introduced. And then if they are asleep, cheap, then you are actually not going to engage with them. We do not wake people to take surveys. We don't shake tents or unzip them or trying to figure out if someone can wake up to take your survey. We actually have a separate observation form, which we'll go over, that you can fill out to count that person without having to disturb them. The other part is just beginning the interview. So if they do agree that they'll talk to you for about 10 minutes to answer your questions, I think one of the biggest things for us is confidentiality and them feeling comfortable in answering any questions that you ask them. So our surveys are confidential. The only one who's going to be looking at the results is obviously you as you take the information, but the COC staff. And we do not ask for any full names or contact information or anything like that, so they will never be tied back to the person. We ask some very minimal information to try to deduplicate people, but otherwise all of their information is kept safe. The other important thing is they don't have to answer any questions they don't feel comfortable with. All of our surveys have an option for did not respond or refused as an appropriate answer. And so at any point, if they say they don't want to talk about that or they'd like to skip that question, that's perfectly fine. At any point that they say they don't want to take the survey anymore, that's fine too. Get as far as you can, and then we respect their choice to end. So overall, this is what it looks like, and we'll walk through the survey. There was at one point a whole conversation about masking. We will have extra masks for you if that's something that you feel comfortable in doing. We encourage you to wear a mask while you're interacting with people, but at one point, especially during mask mandates and things like that, this was a part of our survey, but you'll have those if you need to. So I think overall, just some tips is that you try to talk with people is just about gaining cooperation. I think one of the questions I get asked a lot is, so what am I doing this for? How is this going to help me? And I think the true answer is it's not. It's not going to help you, but it might help someone who's in your situation in the future. So just being really clear about what that looks like and what our hope is for this survey and what we're doing with the information. I think just being really friendly and professional and just being confident in what you're there to do and knowing, again, that respect piece to say that that's okay. And whatever choices that they make, or you're not there to judge or anything like that. Just be really attentive to body language of people and how your body language is, and then helping them answer their questions. Overall, it's a conversation. It doesn't have to be this formal thing. These are people just like us, and we're just trying to share information to get better information for our services. If anyone needs help answering a question, feel like you can do that for them. So if they don't understand a question, but you know what we're trying to get at, help them get through that. It does not have to be asked exactly like it's on the form. Help them walk through it to get understanding in order to answer truthfully. Again, just some do's and don'ts. One thing in particular that we've heard over the years is not everyone describes themselves as homeless. So using housing situation can also be a really good way of kind of getting in there and being able to say you want to know a little bit about their housing situation rather than their homelessness. Again, not every person describes themselves as homeless. I think the other piece is, again, that confidentiality and that rapport to have them say, you control this conversation. At any point you want to end, we can. It's really helpful. And then the biggest thing, I think, is not disturbing people where they are. So don't wake people up. Don't unzip their tents or shake them. You don't have to ask their names. We ask for initials just to deduplicate, but you don't have to ask their names. And we do not force participation. Under no circumstances do we do that. Even if they end early, they're still entitled to their incentive. You can still give them what they get in the end as the reward. So please just make sure we want, to be as friendly and accommodating as possible. In conducting the survey, I think our biggest goal is just getting the most complete and accurate information, but we are trying to be engaged and interested and knowing that they have lots to say. I think for people who experience homelessness, especially chronic or street homelessness, they get ignored all of the time. So you are the first person who are asking for their thoughts and asking for their experiences. So just know that sometimes you're going to get more information than what you're asking for, and so be prepared for that. Be respectful of people's space, especially for encampment sites. You're in their home. So you would treat it just like anything else, as if you were visiting someone else's home. And then again, respondents don't have to answer any questions that they're not comfortable with. The team lead will have all of your incentives. Once you complete a survey, they will be able to give you what you need in order to wrap it up for the last part of the survey with the dispensation of incentives. So again, you're gonna provide them with the information. You can also, we'll have little sheets for you to give them with information on if they have any questions after the survey, that they can contact people that will have those for you. And then you'll return your paper surveys if you're doing your surveys on paper to your team lead, and they'll actually get them back to us to make sure that we can collect all of that information. Just a few safety reminders: never conduct the pit count alone. That's why you are in a team. Stay in sight of your team. Do not wander off in locations or split up your field locations and do them alone to make them go faster. Please stay together. Never do anything that would put yourself or your team at risk. I think it's mostly common sense things, but again, that safety as priority for us, for both the people experiencing homelessness and for our volunteers. Use transportation was part of COVID. If you feel comfortable riding with with other people that you may not be familiar with, that's fine. It's your comfortability. But if you would like your own transportation, kind of caravan to spot, we encourage that as well if that's helpful for you. At any point, if you feel threatened, avoid the situation and call 911 if needed. I can tell you we've been doing this for a number of years, and I've never had anyone need to call 911, but please know all of our local law enforcement are aware of our count, and if there's anything that you need, they are there to assist you. One thing that we have had, especially when it's especially cold, is we have had people who were in need of medical attention. So if there is someone that you come upon and you feel like they need some medical attention, please feel free again to reach out on their behalf. Some of them do not have phones to be able to do that. So if you feel like that's something you need to do, please know that that option is there. And like I said, all of our localities are aware of our count and are ready to respond to any calls that they might get. Just a summary of our materials that you're going to have. So we are going to provide the online screening for you. You'll see that coming through your email next week. You will see your team and site assignments today or tomorrow. And then for any maps for our field location sites, we put those together for you, and so you know exactly where to go and as much information as you kind of trek to your places. We have two options, one for an online form and one for a paper form. So we'll be able to give both of those to you. We'll have masks and we'll have incentives for anyone that might need them. What we expect for you to bring is, if you can bring your own mask, if that's something that you want to do, make sure you have a cell phone that's charged so that you can have access to people. If you can bring a flashlight, especially for our morning and evening teams. Please wear comfortable shoes. I have had people show up to point in time count in heels and ballet flats. It is not a great way to trek through the woods or be walking a lot. So please wear comfortable walking shoes and then dress appropriately for the weather. I would usually be saying bring your winter coat. Now I'm saying wear your short sleeves. It will be hot, and bring plenty of water. We will also have water here if you need them, but please dress appropriately for your weather situation. Yes. I see a question.
Yeah, I just wanted to comment. I participated in the one this past January, and just some of the locations that we went to out in the field were pretty brambly, and obviously it was like really cold out too, so we were dressed like in jeans and stuff like that. Even though it might be really hot, something to consider is still wearing jeans if you're gonna be going out in the field, because it just can be, like I said, kind of brambly depending on where you find out your assignment is. You might have to walk a little distance, like you said, no ballet flats.
Yes.
That was just kind of an observation I made too, because also you have to think about ticks and stuff like that too. But just kind of an idea there for people to think about.
Yes, and I will say I think bug spray would be a great idea.
Yes, that was
Mosquitoes are out. Many people surround their encampments around bodies of water, which is even more easy to get mosquitoes. So I will say bug spray as well. So yeah, thank you. I appreciate that. All right, so a little bit about the surveys. Like I said, we have 2 online surveys. The online survey is submitted directly to us through Google Forms. Though one thing to think about, especially if you're in field locations that you may not have Wi-Fi or a strong signal to actually access the online form. So that's why we always provide plenty of paper surveys to our field teams in particular. But just know you do have that option. Anyone who fills out a paper survey, those still get entered into our online survey by a volunteer, and so they will still be counted. So write legibly as well on paper surveys so our volunteer can see what you're writing. But they will be collected by your team lead and then distributed to back to us so that we can actually use that information. All right, so we're gonna go over the surveys just so you get an idea of what they look like and what some of the questions are. Let me see if I can pull this back up. All right, I'm hoping you can see this all right. Okay, so the first one I have pulled up here is our observation form. In particular, this is really useful for early morning teams. If for some reason you're not able to complete a survey with someone, then you want to fill out one of these forms. And a couple of reasons why you might not be able to do the survey is you can't access the site. You can see it, you can see people, but for some reason you can't actually get over there. They refused, or there's some kind of language barrier or some other kind of issue of why you can't do the survey. And then finally, there's someone sleeping, I think is the most common one. So these just give you a little bit of information to help us know if we would still count that person or not. So if you can see people or they refused, you can tell me how many you see, as much information as possible about the location in which you're in. You can write that on question number 3, and then just a little bit about their demographics. Question 8, we ask a little bit about their clothing and their other information. This helps us with knowing if we have spotted them elsewhere, and so that helps us with deduplicating as we can't get some of those other informations to help. So we don't want to count someone twice, and so this helps us with getting those. This is the only form in which you will make your own judgment on age, gender, race, and ethnicity. So I know everything we're taught is not to assume, but for this, you're assuming. But I've also seen some of our early morning teams actually use this just to take some notes on the location, which is fine too. So even if you don't see someone, I've had someone fill this out and say, it looks like an older campsite and no one's used it in a while. That's really helpful for us, for future pit count, and for our outreach team who are going to these sites after us to help provide services. And so anything that you want to use these forms for, we'll have plenty of forms for you to kind of jot down information on the sites that you're going to. All right, so the next one we're going to look at is the full survey. Before I jump to that, is there any questions on the observation form that we wanted to talk about? Okay. All right, full survey. So I'm hoping this makes sense, and I'm going to try and make it as clear as possible because I know I get a lot of questions on who do I survey? And so we actually complete a survey with each adult that we interact with. So if you stumble upon a family of 5 and there's 3 children and 2 adults, you're actually going to complete 2 surveys. You're going to do one for the, let's say, traditional parent, number 1, and then for your parent number 2. We do not complete surveys with children unless they're the only person in the household. So if you stumble upon a 17-year-old who's in a household by themselves and unsheltered, then we do want to complete a survey for that person. The other exception is if you stumble across a family of 5 and there's a grandma, mom, and a child who also has a child of their own. So then you want to do the parenting youth. And so it can get really complicated. If you have any questions about which family members to do a survey with, please talk to your team lead. They're really helpful in helping you figure that out. But I think the biggest thing is no minors unless they're by themselves or a parent themselves. So we have a little script here, and you can tailor this to however you feel comfortable in saying this. But basically, we'd like to do a survey with you about your living situation. We're doing it to help our programs and our services improve. Your participation is completely voluntary. You can choose to end at any time. Your answers are confidential, and we don't share it with any side outside our team. And you can feel free to skip or end it at any time. And so if they say, yep, sure, I'll take your survey, then you go ahead and answer the questions. I think this is where we have the biggest change for this year. We are not necessarily filling out surveys just for literally homeless. So you'll see that all of our possible living situations are kind of together. We are still looking at the difference between unsheltered and sheltered, but we still want a lot of information from people who are possibly experiencing homelessness just in a different way than what HUD usually looks at. And we have that flexibility, I think, with this not being a required PIT count, but we're using it more for local data. So if they list any of these living situations, then you can complete the full survey with them. The only one that you're going to skip is if they rent or own their own house or apartment. That to me means they have some stable housing, even though it might be a difficult situation or a struggle to keep it. But right now they're pretty safe. And so we're going to just complete the first page with those folks, but anyone else, we're going to go through the entire survey. For anyone who says that they might be staying in a hotel or a motel the night before, we want to know who paid for their room. That helps us track, again, the literal homeless is a charity or an organization paid for it, though at risk of homelessness is those who paid for it by a self, friend, or family. Number 3, we're really looking for who was in their household on the night of the point in time count. So if they stayed in a hotel but their children stayed with grandma, we do not want to know about the children. It's really who was with them on that night. We especially see this with children. They want them in a stable, safe situation while maybe they spend the night in an emergency shelter or their car. And so in particular, we just want to make sure we're delineating between who was with them and not. Question 4 is the information that we start to ask about deduplicating. So we only ask for the first 2 letters of the first name and the first 2 letters of the last name. We are going to compare that with their birth date to all the other people who also share those letters and birth dates and see if we've counted people twice. Perfectly fine if we end up counting people twice. It happens. People want double incentives or whatever it is. But we have a way on the back end of figuring that out. For gender, Hispanic or Latino, and race, this is where you are not going to assume. You are going to ask them what those are for them. For gender, they can pick up to all of them. So please make sure that you ask them all the options and that they can pick which one's right for them. Same thing with race. They can pick as many as they would like. Whatever they identify with is great. For the next question, we're actually going to then repeat that information for everyone who's in their household. If you have 2 adults in the same household, this information will keep repeating across surveys, so just know that. But it's the way in which we do it to collect households together as we collect information. Number 6 onward will be only about the person that you are actually surveying. So we want to know about the person that you're talking to, whether or not they have any of these situations or disorders in their life. We ask a few questions about their job history, lots of questions about their veteran status, if they happen to be a veteran. 15, 16, 17, and 18 are probably the questions that I get the most questions about. This is us trying to ask about their history of homelessness. They are not worded in the easiest way. This is actually HUD language, and I know that. Sometimes it's easier for people to kind of get a conversation with people and say, so you slept in your car last night. How long did you sleep there? And before that, where were you staying? And how long were you there? And before that, where were you staying? And how long were you there? So kind of get a little bit of history from them. Sometimes that can be helpful, depending on what they feel like, interacting with. And I think you'll be a judge by the time you get to 15 or 16 of what kind of responses you'll get. But basically, 15 is just asking as if you've ever been homeless before. 16 is asking about this current time that you're homeless, how long has it been? 17 is asking about this time as well as others in the past 3 years. How many times do you think you've been homeless? And then if you add all of those episodes up together, how long have you been homeless? I think the nicest part of this is once you get to 12 months, you don't have to keep counting. So help them with those. But anything that you can do to help them try to get to an answer, go ahead and do. I think these are the ones I'm like, I don't even know what that means. And we have a little bit of a conversation about it. So again, you don't have to ask them just the way that they're worded. Help walk people through them if they need that. We asked some questions about their transportation and their education. The question 23, 24, and 25 are really helpful for us from a locality standpoint. We would love to know why people are in the area. We'd also love to know what locality they came from. We asked 24A about zip code in particular because lots of people will tell me that they're from Fredericksburg and then tell me that their last zip code was 22405, which is not Fredericksburg City, it's Stafford. And so it can be really helpful to get both of those. If they don't know the full zip code or don't know it, that's okay. We'll still work with the information that we have, but it can be really helpful just because of that difficulty around the Fredericksburg in particular. Factors for homelessness, we did add a couple this summer, hoping that will broaden the range of options that we've heard. But there's always that other box if they need some other kind of explanation about why they think they might be homeless. We asked about homelessness as a child and foster care because that actually puts people at higher risk of homelessness. So we would love to know what portion of our population falls in that boat. The last couple of questions is about healthcare. So we asked some questions about what that looks like for them and how they're actually accessing healthcare in our region. And then the very last question, which we're really excited about, is whether or not they'd be interested in continuing to share their experiences and thoughts with us to help in our planning process. We have a newly formed lived experience committee, which includes people with lived experience of homelessness who are looking at the COC's policies and procedures and the way we provide services to continue to do this on a monthly basis. So we'll have a little handout for you on the lived experience committee. If they say yes, then we'll give you that information for them to know what the group is and ways to reach out to us to get involved. And so it'll be on them to kind of take those steps. You do not have to take their contact information down on the survey. Like I said, we want to keep the survey as confidential as possible. So we're trying to keep those things separate, though we are trying to make them aware that that is, an option for them to get involved with. 33 always gives them an option to tell you anything else that they would like to know. And I really love this question. We get a whole sorts of range of ideas from what they think they need to providers that they loved or hated. And so it really gives them an open door. Like I said, many of them are being ignored most times. So this gives them free range on this question, not just have us to dictate what we want to know. There is also a spot at the end for the surveyor notes. So anything that you want to know from us, anything that would be helpful for us to follow up on, you can always put anything that you would like to tell us there. And we are the only ones who see that, so you feel free to use that however you will. But that's the full survey. I am happy to answer any questions that you guys have on the process, on the day, on the surveys. I'm here to answer those. All right, you guys are a really easy group. And so, like I said, you'll be getting all of your information for your teams and where to meet people, what times, and what your expectations are today or tomorrow. If you have any questions that pop up in your head as you're thinking through this or going over your instructions, please reach out to me or to Brooklyn. I'm Shukis at gwregion.org, and Brooklyn is Bare, B-A-R-E, at gwregion.org. We're here as a resource for you, but you'll have both of our emails on your instructions for your teams. And we really look forward to seeing you guys next week.
Thank you.
Awesome. Thanks, guys.